I'd like to thank the organizers for the opportunity to present this work done by myself and Dr. Graves in collaboration with the United States Network of Pediatric MS Centers. This study is entitled Menarche and Relapses in Girls with Pediatric Multiple Sclerosis. The study was funded by the National Multiple Sclerosis Society, and my disclosures are listed here. Prior studies have shown that a younger age of menarche is associated with increased risk of MS, which may be mediated by body mass index. Younger age of menarche has also been associated with a younger age of MS onset. The Canadian Demyelinating Disease Pediatric Group also found that in children who presented with an initial acute demyelinating syndrome, a younger age of menarche was associated with a higher or increased likelihood of subsequent diagnosis of MS. A prior small study at UCSF demonstrated that relapse rate in pediatric MS increased in the year of menarche, although the sample size was modest and estimates were thus imprecise. The objective of the current study was to evaluate the association between menarche and disease course in pediatric MS in a larger cohort through comparison of relapse rates across the premenarche, perimenarche, and postmenarche periods. This was a multi-center observational cohort study. We included girls with MS onset before 18 years of age with known menarchal date who had been followed at 12 regional pediatric MS centers who were part of the United States Network of Pediatric MS Centers as of January 2019. Analyses included evaluating the association between the pubertal development stage and relapse rate. To do this, we used both negative binomial and repeated Cox regression models, both adjusted for disease-modifying therapy use and body mass index. The repeated Cox regression model had the advantage of adjusting for disease-modifying therapy use in a time-varying fashion, which is important. Our cohort included 503 girls with MS onset before 18 years of age. As shown in the figure on the left, the majority had MS onset after menarche, with 366 with onset after menarche, although 53 had onset before menarche and 84 had onset in the 2 years surrounding menarche. Studying pediatric MS allowed us to compare relapse rates across these menarche-related time periods in girls with MS. On the right, we show a histogram showing the time of MS onset with respect to the estimated menarchal date. We found the median time of pediatric MS onset was 2.5 years after menarche. Our results are shown here. In bold are the adjusted annualized relapse rates from the negative binomial regression model, in which the annualized relapse rate appeared highest in the perimenarchal period. However, there is concern for residual confounding of this estimate by disease-modifying therapy use, since we were only able to adjust for the presence or absence of DMT use in each of the menarchal-related time periods. This did not incorporate time-varying DMT adjustment. This issue was addressed through use of repeated Cox regression models, which did allow for time-varying DMT adjustment. Here are the results from our repeated Cox regression model evaluating the hazard for relapse across the menarchal-related time periods. After adjusting for body mass index and time-varying DMT use, we found an association between relapse rate and the menarche-related time period. Relapse rate increased across the menarche-related time periods with a 40% lower hazard for relapse premenarche and 21% lower hazard for relapse perimenarche compared to the postmenarche period. As you can see in the bottom 2 rows, there was also a strong association between DMT use and lower hazard of relapse. These findings suggest an increase in relapse rate across the menarchal transition. This suggests that menarche may be a time of increase in disease activity, which may be due to associated hormonal changes. Thus, a change in therapeutic approach around this transition may be warranted. Limitations of this study include the potential for residual confounding, as well as the potential for recall bias, including in recall of menarche dates. We also need further study to understand the mechanism of this effect. Strengths of the study include the large multi-center cohort study of children with prospective follow-up during their menarchal transition. I would like to thank Dr. Graves, who supervised this study, and the U.S. Network of Pediatric MS Centers and the members. I would also like to thank the National Multiple Sclerosis Society, who funded this work, and my fellowship. Thank you.